Sam, and thank you for joining us here at Ndeke House at the Ministry of Health. The Minister of Health is ready to update the nation. This is the 41st COVID-19 update, and right now I will hand you over to the Minister of Health to update the nation.
Good afternoon, Zambia. Good afternoon, members of the press. I do recognize the two permanent secretaries in the Ministry of Health, Permanent Secretary in charge of Administration, Madam Kakulubelwa, Permanent Secretary in charge of Technical Services, Dr. Kennedy Malama. The government of the Republic of Zambia, under the watchful eye of His Excellency President Edgar Chagwa, continues to implement evidence-backed and locally adapted measures to support the response to COVID-19. On behalf of the President and his government, I'd like to thank the Zambian people and all the citizens for the resilience shown in complying to the measures that have been announced, informed by the Public Health Act and the statutory instruments 21 and 22. It is not easy, and we appreciate all of you who have complied to stay home advice, all of you who have avoided non-essential travel, all of you who have avoided travel of business nature, all of you who have adhered to the measures that have been pronounced in the various presidential announcements. We appreciate you because you are saving lives and you are stemming community spread. Members of the press, countrymen and women, Zambia has in the last 24 hours reported 9 new cases of COVID-19 cases out of the 307 tests done by our laboratories in the last 24 hours. The 9 new cases include 3 truck drivers, 1 from Namibia, 1 from South Africa, and 1 from Zimbabwe, and 1 national from Asia who recently came into the country as a consultant for work. The remaining cases include contacts of the cases that we've reported before from Chawama and Chipata and Kanyama, and also from the community screening and targeted testing that we are doing. 1 is from the healthcare facility-based surveillance. We must also report that the 10-year-old child who was admitted to a facility in Kabwe has been discharged after testing sequentially negative twice to COVID-19 and is doing well and is at home. That therefore brings the number of persons that have been discharged, the number of recoveries, to 55. So 55 people have recovered from COVID-19. Therefore, cumulatively, our figures stand at 106 cases of COVID-19, 55 recoveries with 3 deaths. As we speak right now, the number of active cases is 48, with 43 in Lusaka and 42 in Lusaka and 6 on the Copper Belt. All patients in isolation are very stable. Countrymen and women, we want to thank our gallant men and women, boys and girls at the front line, who have worked tirelessly to stabilize the patients that have been admitted. Repeatedly, we have reported to you patients who are unstable and have been surviving on oxygen, have come in with low hemoglobin, have been saturating at very low levels. And we want to thank those gallant patriots for resuscitating them back to life, because all of these are now stable. We have been conducting community surveillance and targeted testing in various parts of the country, and in particular in Lusaka we've been in Madras Kamwala, where now we have tested a cumulative total of 1,780 persons. We'll continue updating you on the results as we continue to upscale our ability in our laboratory testing. The surveillance team continues tomorrow in Rosbach, and will continue to conduct sensitization, mass screening, and targeted testing, including disinfection of public places in the area. Cumulatively, we have discharged 3,025 people from the 14-day quarantine period in the last 6 weeks, and we have responded to 1,276 alerts that we have now cleared as non-cases, and we pay glowing tribute to the public for being alert and informing us of these alerts. Level, we have now surpassed the 3 million mark and are now reporting 3,220,970 cases, with a death toll at 228,251. Important to note that 922,822 people have recovered globally. In Africa, the number of cases has risen to 37,701, and we have lost 1,502 citizens, while we report success in case management as 12,630 have recovered. In the Southern Africa region, where Zambia represents the Africa Center for Disease Control and is coordinating the response in the region, we have recorded 5,756 cases of COVID-19, and out of these, 2,181 have recovered, while we have lost 117 citizens. Members of the press, fellow Zambians, as I have come to the end of my update, I'd like to remind you of one of our core values. This is a fundamental national value. Patriotism remains one of our core national values and principles, and it is pivotal for us to attain victory against COVID-19. We note and remain grateful to the public for maintaining a high sense of patriotism, including our gallant health workers at the front line, our multi-sectoral teams in the communities, and the corporate sector in the fight against COVID-19. Indeed, the patriotism of the citizens that have been coming forward to participate in the mass screening and testing, and that have continued to adhere to the principles of physical distancing, wearing masks, and other guidelines such as heightening sanitation, is applauded. As World Press Freedom Day approaches, we want to celebrate the patriotism of the fourth estate, the media, who are our crucial allies in risk communication and community engagement. Further, we want to thank the spiritual leadership of the church and the various religious groupings and the various traditional establishments for contributing their resource and influence, which has been crucial to maintaining social cohesion in these trying times. To crown it all, we salute the leadership of our head of state, His Excellency President Edgar Chagwa Lungu, as he navigates the challenging straits of COVID-19, skillfully maintaining the delicate balance between running the wheels of the economy and averting a public health crisis. He has exhibited unparalleled political will and unmatched leadership in providing statesmanship to the fight against COVID-19. Countrymen and women, let us forge on. The SAGE is on. We are in the SAGE phase, and as we increase the testing capacity, we expect to see more numbers. Not as a mark of weakness of the response, but because we will be rooting out all the evidence of community spread, all the positive cases, with the view of isolating them and stopping any further community spread. This is fundamental to the fight against COVID-19. Testing, testing, testing is key. We therefore will enhance community surveillance in Nakonde, community surveillance in Lusaka, and we will do prevalence studies countrywide. The idea is to establish the extent of the disease, weed out all the positive cases, quarantine them, treat them, and ensure that we do not have community spread entrenching as we treat those who are positive. This is a call to action. This is what is demanded of all of us, and this is what His Excellency President Edgar Chagulu has said in the various addresses. Stay home and be safe. Wash your hands and clean your environments. Non-essential travel must be avoided. Physical distancing is fundamental, and ensure that public gatherings are avoided. Let us ensure we hold hands, and in solidarity and as a collective, let us fight COVID-19. Thank you for today.
Thank you so much, Honorable Minister, for that update. On those 6 cases investigated, 9 new ones today. We take the opportunity to get questions from members of the press. So I'll take 3 at a time. That is.
Good afternoon, my name is Darius from Grammar.
Darius, are you sure you're supposed to introduce yourself? You introduce yourself every day.
Honorable, what you have been telling us on a daily basis as we give us this update is that PPEs have been distributed in various hospitals, but what we see on the ground is contrary. I was able to visit my child in one hospital today, and he spotted a lot of workers not putting on PPEs, so as another hospital in Kampala has shown another clinic. What is the government doing about that? Another issue also, when the country is dealing with global transmission cases, we're still receiving imported cases. Isn't this not an indication that at least government should be able to close some borders, at least when we're recording these cases, so that we concentrate on local transmission cases? Another question, Honorable, is on, I've received some allegations that the Resident Doctors Association have received threats. This comes as a result of them wanting to have a meeting to air out their grievances pertaining to the cases that we've recorded on some of our health workers. We'd like to get a response from you. And also we have received queries from clinical officers that await to be called since the President announced that we will recruit about 4,000 practitioners, if I can put it that way. Are the clinical officers also part of the 4,000 who wants to know? Thank you.
Thank you. I I think that was a handful of questions. Do you have any other? Honorable Minister, I request that maybe you give responses to those 4 questions, which I will count. One is on TBEs, the other one is on imported cases, then the issue around RDA complaints and mental health.
Our engagement with the Resident Doctors Association of Zambia is not anchored on threats, but on mutual understanding of the demands of the profession and also on collective effort, mutual efforts to fight COVID-19 in particular and to support the President in his quest for universal health coverage. So the Resident Doctors Association of Zambia are recognized as principal allies in President Lungu's agenda for universal health coverage. We, for instance, engage continuously with them, and yesterday was another day that the permanent secretaries had a meeting with the Resident Doctors Association of Zambia leadership to iron out any issues that could have arisen. And this is just administrative in nature, and as you know, the Resident Doctors Association of Zambia have never or were not the proponents of the recruitment of health workers. Neither were they the proponents of the incentive package that government is going to provide. This was announced in one of the meetings as President Lungu thanked the people and the health workers at the front line. He did announce the need for us to recruit more frontline health workers and also to motivate them. So what the Resident Doctors Association of Zambia is doing is what exactly other professional bodies are doing, working with the Ministry of Health Management to support the Zambian people in the fight against COVID, to support the vision of the government under President Lungu in the fight against COVID and in the vision for health for all. So we recognize the Resident Doctors Association of Zambia as key allies in the health sector, and threats are not part of it. As we talk about the trade being a vocation, as we talk about the profession being a calling or being a profession, being a vocation, it's not a threat at all. We're stating facts. So there are no threats issued anywhere, and we do not engage, anchoring on threats. So we have a cordial relationship with Resident Doctors Association of Zambia and with the umbrella body that represents doctors' interests, that is the Medical Association of Zambia. The clinical officers are part of the multidisciplinary teams that are being recruited, and there's been significant progress in the recruitment of health workers, and we will be able to give you all the details of the recruitment exercise as we conclude it. So clinical officers are important members of the multidisciplinary team. They support case management and are very important in surveillance and in many other aspects of the response. Therefore, they are also part of the multidisciplinary team that we are recruiting. We have been procuring personal protective equipment through various suppliers, and some have already supplied and some are continuing to supply. We continue to receive support from well-wishers, from the business world, from cooperative partners for PPEs. We prioritize health workers. We prioritize health workers, and we have made our intentions clear that our health workers will be clad in PPEs to ensure we protect them from COVID-19. And there are some facilities that are dedicated facilities for COVID-19. Should you fall ill and suspect you've got COVID-19, we are not requesting you to report to a hospital. We are asking you to phone 909 or the other numbers that have been advertised. The reason is simple. We'll be able to send support in terms of movement. And secondly, if you should move, we'll guide you which facility shall be battle ready for you. So it is not all the facilities where we are treating COVID-19. We are managing COVID-19 in designated facilities. And to ensure that health workers who are unsuspecting, as they receive you in any facilities, we are ensuring that masks are distributed to health workers. It is the reason we are prioritizing health workers in the distribution of surgical masks. And it is important to note that our needs for surgical masks today mismatch what we've already procured and what we have received from donations. That's why we continue to procure and we continue to advocate for more. What we have is adequate for today, is adequate for tomorrow, and we'll continue stockpiling, we'll continue projecting. So for us, we're not content when we have enough masks for 2 months. We are only content when we have enough masks for a period of 6 months, and going forward, this is what we mean. We'll continue stockpiling to ensure that the minimum stock levels for our health workers is 3 to 6 months. So we are saying we have stocks in our facilities, but we need to stockpile to ensure that we have a minimum threshold of 3 to 6 months. As we talk about the transmission of cases, we started with imported cases, and then person-to-person spread started, local transmission started. Aggressive contact tracing has been ongoing, and we are saying that we'll continue looking for these cases through contact tracing. The imported cases that we continue to receive through the borders are being picked out of a robust surveillance program, out of a program that is an active one to find cases. What should be praised is the sensitivity of the surveillance that is able to pick these imported cases. Remember that Zambia is a land-linked country. You could call it landlocked or land-linked country. Zambia has all the neighbors surrounding it basically shutting down borders, almost all the neighbors shutting down borders. So we are a victim of lockdowns or shut down borders within the region. And so our response, the response that His Excellency President Lungu has supported, has balanced the need for activities in the socio-economic realm to continue while is avoided. This is the reason why movement of goods, provision of essential services has continued. So we are ensuring that there is that careful navigation to assure that we avert hunger, poverty, and disruption in key services. That's the reason why we are allowing fuel, we are allowing mine requisites, so we're allowing food, and we're allowing all the other key essentials to get into the country, while at the same time ensuring we don't import cases. And should we bring in cases, we pick them up early and ensure that we quarantine them. So we are not closing borders because we need to strike that balance between ensuring the economy is running and that our people don't have a public health crisis.
Thank you so much for those responses. I think they were all correctly covered. Do we still have any more clarifications? Questions for the minister? Okay, Honorable Minister, it's not about bragging the press, but I think there's no questions that are coming through.
Well, P.S. Nalupenga would never allow you to gag the press, and he himself is a journalist. So we want to thank you for continuing to support risk communication to the public. Your partnership with government is key as the media to ensure that the people are well informed to support the response to COVID-19. This is a community war, public health war, and it will only be won with collective action. Let's stay home, let us be safe, let us avoid non-essential travel, and let us ensure that we wash our hands, keep the environment clean, ensure physical distancing, and avoid public gatherings. Should you have need for any form of gathering, ensure you apply, and we will judge you based on the regulations and the guidelines set out in the Public Health Act. And we will certify if you meet those, and if you don't meet those, we will not certify. And if you gather and you don't have that authority, we will ensure that we protect you by ensuring that the enforcement officers do not allow you to proceed. And we'll do it within the provisions of the law. We assure you that government under President Kachagolo remains committed to fighting COVID-19, and we will only institute or execute evidence-backed, cautiously executed measures to ensure that that delicate balance that is required for us to avoid hunger and poverty, for us to gradually return to normal livelihoods, is mixed with the need for us to avoid public health crisis. 106 cases, 3 deaths, 55 recoveries, and under active care for the two. The Kawe lady, the Kawe young girl discharged, and that is a good sign. We'll meet you again tomorrow.
Honorable Minister, I think before we could actually conclude our press brief, we still continue having support from the officials. And today we have Liquid Telecom, the Media Society of Zambia, the Truckers Association of Zambia, and we have our very own, in our own capacity, a health worker, senior consultant, coming to the native in our own capacity. So we'll start with Liquid Telecom and we'll follow the other.
Afternoon, Honourable Minister. Mark, CEO for Liquid Telecom. I first want to take this opportunity to commend the Ministry of Health and Government for this fight against an invisible enemy. And we are here to support this fight against COVID-19. As Liquid Telecom, we spare the thought for the patients and the healthcare workers that are in the quarantine facilities. They might be feeling isolated, they might be feeling lonely, they want to communicate with their family. So our pledge today is to provide complimentary internet access to all quarantine centers for use of patients and healthcare workers to ensure that they can communicate with their families, they can keep in touch with their friends, and maybe we can just bring a little bit of joy to the people that are in the quarantine centers. So, thank you very much.
Thank you, Mark. And actually, as used by design, that question was actually coming. What are the health workers that are looking after quarantine patients doing? So basically, I think the answer some of those concerns. May I have further discussion on something?
Good afternoon, Honorable Minister, and fellow members that have come this afternoon. My name is Patrick Malindi. I'm the Vice Chairman of the Traffic Association in Zambia, a trade association which is operating within the confines of Zambia. As part of our corporate social responsibility, we today decided to join the multitude of donors in supplementing government effort in the fight against COVID-19. I'll be failing my duties if I didn't take cognizance of the gallant drivers, truck owners out there that have continued to deliver essential commodities amidst this pandemic. On behalf of the association, I would like to make a donation in kind of the following items: 60 by 25 chlorine packs, 2,000 face shields, 16 liters knapsacks, 100 reams of bond paper, all of which amounts to 118,850. With this, Honorable Minister, we desire to continue supporting your efforts, and we are available as and when called upon, and expect that we can come to a closure of this pandemic. I thank you.
Thank you, Truck Association of Zambia. May I have the Medical Society of Zambia?
Thank you very much. I'd like to recognize the presence of the Honorable Minister, Honorable Dr. the Permanent Secretaries, Administration, and Health Services, as well as the Permanent Secretary from Information. So the Medical Society of Zambia is a professional body for medical laboratory professionals. These are the people that are behind the testing. These are the people that you hear the Minister saying we have 50 confirmed, or 10 confirmed cases. We've never had that. We've had 4 confirmed cases. These are the people who are behind the testing. So today they have sent me here as a gesture of goodwill, apart from being in the front line to do the testing, to do a small donation from their pockets so that they can also contribute to the fight against COVID. Before I just mention what we've brought, I would also like to say that the BMS Center of Medical Society of Zambia recognizes under your leadership, Honorable Mr. your will in order to increase testing, and we are totally grateful for that. We know that we're increasing the testing to include gene experts, to also include other platforms like clinical chemistry analyzers, and we are totally grateful. We need to continue increasing capacity. We need to strengthen management at all levels of care. We need to ensure that this is done so that we are ready, not just for COVID-19, but we are ready for the next pandemic. We also take note of your desire and your political will as well to increase the capacity in terms of research. Basic research is very important. And we need local solutions to our problems. And these local solutions can be in the form of designing laboratory test kits, for example, and we have capacity in country, as we did for the Ebola, where we have capacity from the School of Veterinary Medicine. So we need to give them more capacity and support them. These are different institutions, CBU, University of Zambia, TRC, and so on. We are delighted with your strategic pillars, and we continue to support the fight against COVID. In solidarity with the Zambian people, we are here to contribute 1,000 masks, as well as 230 by 400 milliliters of hand sanitizers, all valued at a total of 30,000 kwacha. These are from the contributions from our medical laboratory professionals across the country. We are very thankful also for your gesture in employing environments. This will strengthen not only the laboratory, but will also give a much needed respite for people to be able to work very actively, especially that testing is increasing. We want to assure you, Honorable Minister of Health, His Excellency the President Dr. Edgar Chabalungu, and the people of Zambia of our utmost dedication to duty. Thank you very much.
Thank you so much, the Medical Society of Zambia. Lastly, I would like to call upon our senior medical practitioner, Dr. Shima, in a personal capacity.
Recognize you, Honorable Minister, our able human secretaries, and the entire team for the tireless work that you are doing in saving lives in Zambia. My name is Dr. Gertrude Chuma. I'm working currently at the Women and Newborn Hospital as head of the Department of Obstetrics. I would like, first of all, Honorable, to acknowledge the efforts in the fight against the COVID-19 under the leadership of His Excellency, the President of the Republic of Zambia, Dr. Edgar Chabalungu. And I thank you for the privilege that I have been given today to add some value to the efforts that are ongoing. If we, as health workers, have been termed as heroes by you, then we say you are the hero of heroes. So thank you sincerely. Patients with suspected and confirmed coronavirus infections require isolation spaces as we manage their condition. These spaces include triage areas, critical care units, isolation wards, and operation theaters. So the coming of COVID-19 has posed a challenge of creating such spaces and to ensure that these spaces have life-saving equipment and supplies. So I would like this afternoon to contribute by donating the following items, which are valued at 120,000 kwacha. Various surgical instruments for use in operation theaters and labor wards, anesthetic equipment required when putting patients to sleep before surgery, including suction machine, equipment to delivery of oxygen to patients, and as we know, in order to treat COVID patients, we require a lot of oxygen. White laboratory cots for use by staff in isolation wards. Honorable Minister, I further humbly request, looking at the need at the Women and Newborn Hospital, that the Women and Newborn Hospital at the UTH is prioritized as a beneficiary of this donation. A message to my fellow frontliners, the healthcare providers: please let us take care of ourselves by complying to stipulated guidelines of infection prevention. The nation needs us. In addition to other PPEs, I would like to encourage every well-wishers in our nation who would like to donate to remember that frontliners need special clothing as they come to work. And this is to minimize possibilities of taking infection to our homes. So we do not have to use our personal clothes at work. So as you plan what to donate, please remember the frontliners. Finally, Honorable Minister, I have personally made attempts at educating fellow citizens and have observed with sadness how the majority of Zambians have taken this serious pandemic very lightly. My fellow Zambians, I would like to say this virus is very serious, it is real. We all have the evidence that it has potential to wipe out any nation that has no regard of it. I urge those of us who have some understanding of the condition to confer upon ourselves champions and take time to educate the vulnerable in our markets, in our suburbs, those of us that are not complying. It is our responsibility, each one of us. Zambia must survive this pandemic. I submit. Thank you very much.
Thank you so much, Honorable Minister. That was the last in the series today. And now I'll call you to
Well, once a teacher, always a teacher. Dr. Schumer is an eminent practitioner of medicine, an obstetrician gynecologist, and I'm one of her students. And she has again shown leadership and her influence in the fraternity by creating a benchmark for all of us as citizens to ensure that we hold hands with the government, with His Excellency President Ruto, and the people of Zambia in the fight against COVID. This is indeed remarkable, and we continue to admire you, Dr. Schumer, our teacher, our senior colleague and consultant, and we thank you most sincerely for this leadership. What you're doing went a long way, and I hereby ask my colleagues to ensure that that donation benefits the Women and Newborn Hospital. We would like to thank the Biomedical Society of Zambia, Association of Zambia, not only for being in the lead in testing, but also for advocating for support for this COVID-19 response by contributing to it. We value your support and we value the input of the health workers in your association who are at the battlefront risking their lives, and some who get infected as they do their job. We thank you most sincerely. We would like to appreciate the Truckers Association of Zambia. Yes, you keep the wheels of the economy running, and you are great allies of President Ruto's agenda to balance the needs for us to run the economy and avert a public health crisis. You continue at the battlefront, ensuring we have fuel, food, agricultural products, mining requisites, and ensure that the economy keeps ticking, even as we battle COVID-19. We value your contribution. We would like to thank all of you who have donated in the past and who have come here to work with us to ensure that the battle is won. Now, for us to ensure that we manage the war against COVID-19, one key fundamental is data management. Liquid Telecom are now one of our key allies in supporting data. By supporting internet at our facilities, we are not only enhancing communication for our health staff, but you're also enhancing transmission of data. Your support towards COVID-19 is highly valued, and we recognize you as a strategic ally in the fight against COVID-19. We thank you profusely for that great support. We now come to the end of this update, and we'll meet you tomorrow at 11:30.